We're looking at the next aspect of acute rheumatic fever, and this one is around the epidemiology of this disease condition. So epidemiology is more of like how this disease condition has affected the world. We're not trying to look at history or look at in-depth of geography here, but we'll just talk about some important values, okay, and it gives you an insight, okay, to why this disease condition is important. So this image summarizes a lot of things. Okay, there is a whole lot of color coding. Then down here you can see that the case is per 1,000 people. That means you find out the population of a country. So you say if 1,000 will give you 3, the total population will give you X. You cross multiply. Do you understand? So you can pause here to look at it. Okay, different colors have the different probabilities per 1,000 people. You pick the 1,000 people randomly, of course. So acute rheumatic fever remains a major public health concern, okay, in countries that are not really doing well. Okay, the amount of money a country has also determines the type of healthcare systems they'll be having, the type of sanitation. Do you understand how people be eating well, the citizens' well-being? Okay, so high burden regions. Which regions will you always see this disease condition dense? So regions having dark purple and dark blue, of course, these places and these places. I seen it. So this map is a whole lot of information. So it's most prevalent in sub-Saharan Africa, South Asia, Pacific Islands, and some parts of Latin America. So those areas, they often lack robust streptococcal infection control and access to healthcare. So decline in high economic countries. So in places like United States and West Europe, the incidence has dropped because there's improved living conditions. The group A streptococcus is not finding a place to even grow in the first place. Do you understand that kind of thing? So rheumatic heart disease causes about 200,000 to about 250,000 premature deaths every year. Now these numbers are actually sounding like statistics to you till your family member dies from the disease, till your mother dies from the disease. You cry at the burial, and that's where you know that rheumatic fever is a serious thing, So usually causes a lot of heart-related deaths in children, okay, and also young adults. This also stands as statistics until you give birth to your child, okay. After you struggle with the child, it's almost 6 years. You are trying to say the child is like, primary 2. Then the child dies. You bury your own child. So some of these things, we shouldn't look at them as statistics only. They should motivate us, okay, to read better about a disease and know how to handle it better. So age group affected usually occurs in people that are between age 5 to 15. That's a school age. Alright. So in the early 90s, USA saw about 5 to 10 cases per 1,000 population, but it has reduced. Why? Because there's improved healthcare system, there's improved living conditions of the citizens. So this makes you to rule that in countries that are not really doing well financially, you have much of those issues, okay. Then also genetic issues are there. Sometimes it just runs in a particular group of people. Then also, if you don't have good quality healthcare system, you are likely to have these issues more.